So dear friends, in the following seminar we will talk about suturing and suture techniques in periodontal and implant surgery. One of the problems in suturing is the trauma. Suturing always is a trauma. So in the first 24 hours the mechanical trauma will be the main trauma, while in the following wound healing period trauma by bacteria will increase. Bacteria adhere to all non-shedding surfaces. That's why plaque control during the healing period is of utmost importance. Today we have suture materials that are coated with, for example, triclosan that inhibits the adherence of the bacteria in the wound healing period. It depends on how long the suture will stay in your oral cavity. The longer they stay, the deeper the bacteria will penetrate along the stitch canal and along the suture strand. That's why I prefer the sutures to be removed at the earliest time point possible. I think there is no one general time point ideal to remove the sutures. It depends on the surgery and on the stability of the wound when we remove the sutures. On the right side you see such inhibition zone by triclosan on this suture strand. Today we not only have the resorbable ones that are coated with these inhibition solutions, but also the non-resorbable ones. We choose suture diameters in periodontal and peri-implant surgery. Very often 3/0, 4/0 or maybe 5/0 sutures are chosen. Surgeons are choosing suture material based on tradition, habits or whatever, or the price of the material, but very rarely depending on the biological properties of the sutures. Does it make sense to choose a suture with a diameter 3/0, 4/0 that can be loaded up to 10 or even more kilograms when you suture such a very little tiny papilla? You can see in this graph that the breaking strength depends a lot on the diameter of the sutures. In a recent experiment, we were influencing the diameter of the sutures to the breaking strength and, as we have already seen, to the forces that are brought to the clot. We were harvesting soft tissue grafts in picture mucosa, and we were trimming the grafts to a defined width and length. Then we were attaching these grafts in an apparatus of a Swiss textile company with different diameters of sutures, 3/0, 5/0, 6/0 and 7/0. While in the 5 and 6/0 we also tried with different needle configurations. The measurement arm was moving with a constant speed until something happened. So you can see that in the thicker sutures, the tissue breakage was the main event, while in the thinner sutures, almost exclusively, the suture breakage was the main event. That means that by just choosing a thinner suture diameter, we can define the force that is brought to the tissues. So this could be a control of the tension that is brought to the wound margin and at the end to the blood clot underneath. Based on these experiments, I recommend in periodontal and peri-implant surgery to choose suture diameters in a range of 6/0, 7/0 and maybe 8/0. On this slide you see a suture papilla, and you can imagine that a tissue with a diameter within millimeters should not be sutured with suture diameters of 3/0 and 4/0. Otherwise the mechanical trauma will be too high, and additionally, as we already have seen, the tension of a suture of 3/0 and 4/0 cannot be controlled by the surgeon. In the following section we will talk about suture techniques. So the basic technique is an interrupted suture. Handle the tissues with care. That means when you grasp the tissues, use an anatomical forceps. Try not to squeeze the tissues. Support the tissues with your anatomical forceps and slowly pull the threads through the tissues to avoid the sewing effect. If you do an interrupted suture, try to grasp the whole tissue thickness. So you enter right-angled and you exit right-angled. Try to keep the bite size, that means the distance from the wound margins, the same on one side than the other side. You can stick in the needle in the neighborhood for a fluently work. You can do that even in the sites where there is no anesthesia, because the epithelial, the thickness is thick enough to stick in the needle and the patient will not experience pain. This guarantees a fluently work as you can grasp the needle immediately in the right direction that you go on with suturing. When you tighten the knot, do it visually guided and not with your tactility. The reason is when you are using very thin suture diameter, you cannot have tactile feedback. That means when you pull the thread, it will break without any resistance. Something else that is important is that what I already mentioned, why you choose or tighten the knots or suture with two instruments. The rotating movement for the right-handed persons from 2 o'clock to 7 o'clock is the most precise movement the human body can perform. So when you use instruments without rounded handles, you cannot guide the movements like this, but the movements are guided with the muscles of your forearms, which are more coarse than the muscles of your fingers. Beyond these interrupted sutures, we have 4 basic techniques of mattress sutures. We have inverting and everting mattresses and horizontal and vertical ones. Between these, you have many forms in between. These are just the basic techniques. Here you see again, as an example, the horizontal everting mattress that can be used for closure of a crestal incision, especially when you have some biomaterials underneath and a primary closure must be guaranteed. Again, you pull the thread very slowly through the tissues and then you go to the opposite margin. It is important here that you initially pull the thread to a short end, otherwise you will have more sewing effect in your tissues when you only pull it at the end. You right angle penetrate again and then you suture the thread and tighten the knot. As you can see here. It depends on the suture material, how many times you turn the thread around the needle holder, but usually 2 times with a double sling is enough to secure the knot and it will not open anymore. I hope I could give you some valuable information about suturing and suture techniques. Thank you for your attendance.